Hi, Steve.
Hey.
Thanks for coming in for your performance evaluation
Sure.
today. I just want you to know that this is a safe place and that we're going to talk about both your strengths and some things to improve. How do you feel like everything's been going lately?
I think pretty good. I mean, I'm still relatively new here, so still trying to get my feet under me. But I feel like when I come here, I'm doing my best. Sometimes I get a little overwhelmed and things might not go as smoothly as I would like for them to. But I think overall, I feel like I'm doing okay.
Good. I really appreciate your effort on the floor. I can see the improvement. Tell me what you think is still maybe not going as smooth as you'd like.
Well, maybe the main thing is that when we expanded the unit, our shift work really picked up a whole lot more. And again, still kind of being new and onboarding, the patient assignments got to be a lot. I mean, I'm looking at my patient assignment here and it's like the paper's full, right?
Right.
So it's just a lot to kind of balance, especially being new. So I would say probably that's been the biggest adjustment so far for me.
Sure. Okay. Well, some of the feedback I've gotten from the other nurses, most of it's really good, but there has been some concern that maybe the last few months you've had an issue with some time management, especially patient assessments, charting. There were a few instances where documentation was incomplete or delayed, which affected the patient care continuity.
Yeah. I mean, like I said, I just feel like I'm really busy, and sometimes I struggle to keep up a little bit. But I always get my work done like by the end of the shift. Sometimes I have to stay a little bit later, but everything always gets done before I go. I guess that's for me kind of a positive.
Okay.
I feel pretty good about that. At least I'm being able to get my work done.
Okay. Well, I know when things are really fast paced, and especially with the unit expanding and having a more patient load, that really does take a little bit more time management. But things like charting and patient care, patient communication, needs to be done in a timely manner so other people can get their jobs done as well. And it's really having an impact on the ancillary staff.
I didn't really think about it that way. I guess, like I said, being busy, like it's just blindfolds on, and like you feel like I'm just trying to get through whatever my job is, not worrying about other people, just making sure that my tasks and my obligations are being met. So, I mean, putting it like that, it really makes sense that I could probably be a little more considerate of other people and trying to get things done in a little bit more of a timely manner. Like I said, even if it doesn't get done right then, I feel like I'm still able to like catch up later.
Right.
That's interesting and helpful
Okay.
that you bring that up.
Well, time management is really a nursing skill, and it's to be learned. I'm here to support you. So let's focus on some solutions. I'd really like to work with you creating maybe a time management strategy, maybe a flow sheet, helps you prioritize your task. We can look at some tools and techniques to help you stay organized during the shift. How do you feel about maybe even checking in weekly to make sure that everything's going okay and that maybe you don't need any more support?
I think that's great. That sounds helpful to me. I mean, especially with how overwhelming things have been. If there's something we can do now to kind of curtail that and maybe help me learn some adaptive strategies to make me better at my job, I certainly welcome that. Yeah.
Sure, absolutely. And once you get time management down, it's going to become second nature, and you will go ahead and be an amazing nurse. Your skills are fabulous, and we are here to support you in any way that we can.
Awesome. Well, like I said, I appreciate the opportunity and your availability to be a resource here. And I'm willing to try anything, especially as I'm trying to establish myself here as an asset to the team. So I appreciate your time. Thank you.
Absolutely, anytime.